Joan came to us. She was referred through the criminal justice system. We have a program that works with folks who are involved in the court system, provides case management, serves as a liaison between the individual, the treatment system, and the court. She was engaged in that program, had been doing okay. We became concerned because we found out that she was homeless. So our treatment program referred her to our homeless program, so she was engaged in permanent housing, permanent supportive housing. So she was getting case management in the criminal justice program, case management in the housing program, and was doing okay. Well, at some point in time, she went home to visit family members in another county. When she was there, she was picked up because she had not been paying child support. In the course of her addiction, she was dependent on opiates, had been abusing amphetamines as well, which at the time we didn't necessarily investigate, because it is odd for somebody to mix opiates and amphetamines unless it's opportunistic use, meaning she had access to it and just tried it. She was incarcerated due to not paying child support in the course of her addiction. Her children had been placed with her ex-husband. And while she was in jail, she was not receiving her psychiatric medications, and she detoxed in the jail. In that time period, came back after she served her time, deteriorated. She was having hallucinations. She was not intact with reality, not bathing, not eating. She was in fact very underweight. We became concerned that we weren't going to be able to serve her in our housing environment, because it is independent living, it's permanent housing. She should be able to come and go and care for herself. We were really concerned that this was going to become somebody that was going to be committed, because she refused hospitalization. She was aware enough to know that she had rights, and our criminal justice program was going, well, we don't know that we can help her either. So at Meridian, we have a co-occurring treatment program. And the co-occurring treatment program evaluated her and said, this is someone that we should be serving. And through her continuous use, she was relapsing throughout this time period, was at risk for going back into jail. So we ended up engaging her in our medication-assisted treatment program. Our co-occurring counselors can work both with the physicians in our medication-assisted treatment program and with the psychiatrists in the co-occurring program. So about 6 months into this, we found her finally stabilized, in that she was aware that she had a substance use problem. She was no longer using substances. She was taking her medication daily for her opiate addiction, and was engaging appropriately with our psychiatric services and the counseling, and thus stabilized in our housing environment. So we were looking at a woman that we were worried was going to be committed to a state hospital because she was deteriorating so badly, to a woman who was now able to engage in a treatment program, attend appointments, eat, was gaining weight, looking healthy, and was engaging in daily hygiene as well. So we were very happy about that. And now we're another year later, she's completely stable. She's in our maintenance program. She has a job. She's beginning to pay back child support. We're not sure she'll ever be able to have custody of her children again, and that they're in a stable, happy living environment, and her ex-husband, is doing well, taking care of them. But she's able to visit with them. They can count on her showing up for visitation, and she's stable. You know, she can assure them that mom is working a good program, is working, employed, and can be a part of their life more often. And that was her goal all along. You know, she just didn't want to permanently lose her children, and she wanted to be okay, but she didn't know what okay looked like. So we're here, and we want to keep her here, and we're hoping that, you know, we can continue to work with her long term. This is someone who will have a chronic care model, and that will be working with her for many years on staying stable and being happy and healthy. In understanding her case and talking with her once she was lucid and well, there were major traumas in her history. You know, we're looking at domestic violence, sexual abuse, multiple violations of her own security. And as she became more sick in her addiction, she lost the supports that she had to even get to this point in adulthood. So it's going to take years to help build that back up around her, and to have the patience now to be aware that it's a process, and that over time she'll be okay. But she's going to need her co-occurring treatment counselor in psychiatry and medication-assisted treatment for a while to get to where she can be stable long term. As a team, we use an integrated approach. When we have somebody that's involved in multiple programs and community systems, we like to do wraparound meetings. The drug court was involved with this case. We had our criminal justice program, the co-occurring, the physicians, the psychiatrists. We would get together, and just when we thought we had a thumb on what was going on with this individual, she would unravel a little bit more. So it took some diligence, some time, some patience, because we could have easily said that this is somebody that we don't know that we can help. But we were committed to bringing her along, and we knew that we had the pieces to help her. It was just a matter of giving it some time and really, really encouraging her. And honestly, to see her walking down the hallway of her housing, to see her have light in her eyes, be happy, be healthy, that's what we do this for.